together and going toward a single payer system, which would you choose? And the students specified that you cannot say fix ACA and move toward a single payer. They want you to choose. Which is it? Fix the Affordable Care Act or scrap it and go to single payer?
I think either way, we have to fight for what is the #1 goal, which is universal health care coverage. The Affordable Care Act came a long way. It got us to 90%. 90% of the people in this country are now covered by insurance. It didn't go all the way. It didn't go to 100%. That's my goal. We have got to do that. I think the best way to do that is through Medicare for all. By doubling down on the parts of our healthcare system that have the lowest costs, the best patient outcomes, that I think is the best mechanism to create some real change. If we're unable to do that, if it takes a long time and it's really hard to fight for that, we gotta fix Obamacare as it stands, right? But we gotta do both at the same time. We gotta walk and chew gum. I think we have to fight for our values, which are universal health care coverage. We also have to make sure that we fix the problems that we see in our system every day.
Thank you, Josh. Virginia.
Want me to tell you, as somebody who benefited and who received health care for the first time in many years with ACA, I saw that as the beginning and not the end. I saw that it actually provided many of us with pre-existing conditions with health care coverage for the first time. But I can also tell you that the system is absolutely flawed and broken. If you have a son who's in a massive car accident and your hospital bill comes back at $48,000 and the insurance only paid $21,000 and you're on the hook for $27,000, that's not effective health care. If your doctor is sending you to get lab work at the hospital and you're asked to tell them that you're a cash pay patient so that you can pay $90 as opposed to paying $700, which is what they're going to charge the insurance, the system is absolutely broken. But I can't say that single payer is the answer either. I believe that we have to give everybody quality, accessible, and affordable health care regardless.
Thank you, Virginia. Mateo.
So I'm going to work for effective nonprofit healthcare. The problem with Obamacare is it was essentially a bailout for private insurance companies. There were a lot of people that greatly benefited under it. Were able to receive health care for the very first time, and I have family that qualifies under that, so I'm not knocking anybody up here or anybody in the crowd. The truth is, it did not insure everybody, and the most sound path to guarantee health care for every American is Medicare for all, a fiscally sound Medicare for all. Right now, we're not having a healthcare debate. We're talking about just how rich to make individual companies that have unaccountable power. We've seen that by the way companies pull out of the marketplaces, raise rates. I think in 2018, rates are scheduled to increase some ridiculous percent. So a single payer healthcare system, Medicare for all, is the best way to get veterans, seniors, newborns, healthcare. People make the case that the problem is because they'll be switching health plans and this and that. You're still gonna have to switch to Medicare when you turn 65, and you usually have to switch when you switch employers. So it's the most fiscally sound policy.
Thanks, Mateo. Johnny.
No question. I support single payer, a guaranteed healthcare system for all. Thank you.
Thank you, Johnny.
How about we join the rest of the civilized world and have a single payer healthcare system? We're one of the only countries in the world that does not care enough about its citizens to give them health care and make sure they're healthy and, have a choice to not die or go bankrupt. Where are our priorities? I personally have had tens of thousands of dollars in medical bills before the Affordable Care Act, but it was still not far enough. We need to put people over the insurance companies and actually care about one another. So 100% single payer.
Thank you, Tara.
The Affordable Care Act has brought health care to millions of people that otherwise would not have had care. my question would be to anyone up here that supports single payer would be, how is it going to be paid for? That is really the bigger question, the cost. I believe in affordable, quality healthcare and access for all. The key is to find a way that will take working together across party lines to come up with real answers and ways to take care of everyone that deserves the treatment that they should have. Thank you.
Thank you, Sue.
Well, I'm an accountant. I do budgets. On my website is a balanced federal budget that fully funds Medicare for all now and still produces a surplus. And it also funds incremental amounts per year for the infrastructure needs that we have. One thing it doesn't fund is, which I need to figure out and work on, is free tuition, but I'm thinking about that all the time. Even if we have Medicare for all fully funded, we still need to worry about Medicare Advantage, because Medicare does not pay for everything. Once we get Medicare for all, we need to fix what's left. But before we can get there, we need someone different in the White House, and we need a lot of different people in the House of Representatives, and we need people there who know how to do budgets, and that's what we need first. Thank you.
Thank you, Mike.
Well, thanks. On the way to Medicare for all, it's there's a lot of things we can do, but the thing to keep in mind is that healthcare is a right, and it's a universal right for every one of our citizens. So the people out there that are saying, hey, we're protesting against single payer, just look around the room and point out somebody here that doesn't deserve healthcare. We all do. And the fact is, we can get there, and we can get there today. It might not be Medicare for all today or single payer today, but we can have Medicaid for all today. You know, they just passed this tax bill, this tax budget bill. The one thing they didn't do was allow healthcare premiums to be deductible. They get breaks for millionaires on Wall Street, but your healthcare premiums aren't deductible. That's where their morality lies, and we're going to change that.
Our next question is also coming from a student group, and we have a representative from the Black Student Union here on campus to ask your question. Virginia, you'll start us off with the answer.
Hello. So as you know, we have